Hello everyone. Let me discuss the questions of the GT12. So in case of streptococcal pharyngitis, how early should the treatment be initiated to effectively prevent the rheumatic fever? 7 days, 8 days, 9 days and 10 days. So according to the guidelines, it is within 9 days, right? So within 9 days, you can start the course of penicillin, right, to prevent the development of this rheumatic fever. So the answer is 9 days. An athlete collapsed suddenly and died on the field. The postmortem heart is shown in the figure. There is family history of the disease. What is the diagnosis? HOCM, mitral regurgitation, mitral stenosis, aortic stenosis with left ventricular hypertrophy. So you can see here, it is the septum which is hypertrophied. This will result in what is called the hypertrophic cardiomyopathy. This will result in what is called hypertrophic cardiomyopathy. Next, levodopa test is used to detect LH, ACTH, FSH, then growth hormone reserve. So, levodopa test, it is used to detect the levels of the ACTH. It's a direct question, right? Next, a patient with pheochromocytoma would secrete which of the following in a higher concentration? Norepinephrine, epinephrine, dopamine, and vanillyl mandelic acid. So, in pheochromocytoma, norepinephrine will be more than compared to that of epinephrine, whereas pheochromocytomas of MEN2A and MEN2B, in this scenario, here epinephrine is more than compared to that of the norepinephrine. Epinephrine is more than compared to that of norepinephrine. Okay, next. Identify the endoscopic image. Caustic burn, eosinophilic esophagitis, pseudomembranous colitis, normal esophagus. So this is suggestive of the eosinophilic esophagitis. So endoscopic view, it shows the corrugations, right? Or you are having the ring appearance, which is suggestive of diagnosis of the eosinophilic esophagitis. And to confirm the diagnosis of eosinophilic esophagitis, what is that you need to do? You need to do HPE examination, where you can do the high power field examination on the biopsy. You take the esophageal biopsy and you do a HPE examination where you will see the presence of eosinophils. And how many eosinophils will be there? More than 15 eosinophils will be there per high power field. Okay. Next, arsenic is used in the treatment of acute promyelocytic leukemia, ALL, CML, transient myeloproliferative disorder. So in case of acute promyelocytic leukemia, arsenic is being used. Okay, next question. 60-year-old person presents with history of angina and shortness of breath for the past week. Blood withdrawal shows thick brown red color. What is the diagnosis? Sickle cell, hemolytic anemia, methemoglobinemia, G6PD deficiency. In case of the methemoglobinemia, you will have thick brownish red color upon drawing the blood. Whereas you take sickle cell, it is usually pediatric presentation. Here the age is 60, so option A ruled out. Hemolytic anemia, they will cause pallor, right? And you don't have the brownish discoloration of the blood in case of hemolytic anemia. And G6PD, it's an intravascular hemolysis where the individual will have hemoglobinuria and will cause black color urine in case of G6PD, right? So therefore by exclusion, the answer is the methemoglobinemia, right? Next question. Indicators of active multiplication of the hepatitis B virus is HBsAg, core antigen, envelope antigen, anti-HBsAg. So HBeAg positive, that tells that the virus is actively replicating. That tells that the virus is actively replicating. Whereas you take the surface antigen if it is positive, that tells hepatitis B is present in the person, right? Core antigen. Core antigen is not very much visible, but antibody to core antigen will tell you whether it is acute or chronic hepatitis. Okay, next. So the one which will tell you multiplication is envelope antigen. Next question. Not the major criteria for the diagnosis of the Neurocysticercosis. Okay, so detection of cysticerca antigen by immunoblot, it is the major criteria. Detection of cysticerca antigen by ELISA, no, it is not a major criteria. Cysticerca lesion in the brain parenchyma by MRI, yes, it is a major criteria. Calcified lesion in brain parenchyma by CT, yes, it's a major criteria, right? But the B is not the major criteria for the diagnosis of the Neurocysticercosis. Next, renal vein thrombosis is associated with which underlying disease of the kidney? chronic glomerulonephritis, pyelonephritis, SLE, and nephrotic syndrome. Renal vein thrombosis, it is observed in membranous glomerulonephritis, which is the part of the nephrotic syndrome, right? And almost 40% of patients with membranous glomerulonephritis, which is observed in elderly individuals, have the renal vein thrombosis. Okay, next. Now, the gross specimen section of the kidney depicts renal cell carcinoma, medullary sponge kidney, a polycystic kidney, and then hydatid cyst. So you can see that there are multiple cysts within the kidney, which is suggestive of a polycystic kidney. Next. The submerged part of the cerebral cortex is the insula, Brodmann area, corpus callosum, then the piriform sulcus. So it is the insula. Insula, it is also known as the island of Rel, right? And the word insula means hidden, right? The word insula means hidden. Okay, and this particular insula, which is hidden, right, it is the submerged part of the cerebral cortex. Next. Middle-aged patient presenting with the history of left-sided weakness for 2 days. Currently, the patient is extremely drowsy and underwent non-contrast CT. Which of the following is the best treatment for this patient? Aspirin or clopidogrel, mechanical thrombectomy, mannitol, decompressive surgery. Now, you see, this patient is having a hypodense lesion, which is suggestive of infarct. And along with that, there is also a midline shift. So these patients will definitely require decompressive surgery. One of the very important indication for decompression is midline shift, and this hypodensity is mainly due to MCA territory infarct. So these patients definitely require the decompressive craniotomy that has to be done. Okay, next. This patient came with the history of chronic productive cough and clubbing and coarse drolls. What is the diagnosis of the CT brain? Bilateral varicose bronchiectasis, multiple cavitating secondaries, interstitial fibrosis, miliary tuberculosis. So what does it suggest you of? The presence of bilateral varicose bronchiectasis. Bilateral varicose bronchiectasis. And here you have multiple cystic clusters of thin-walled cystic spaces in the lung parenchyma, which is suggestive of bilateral varicose bronchiectasis. Okay. Next question. Aspergillosis can present with all except lung cavity, ear infection, normal component in sputum, rhinocerebral involvement. In case of aspergillosis, you don't have rhinocerebral involvement. Which condition you will have rhinocerebral involvement? Rhinocerebral involvement is observed in case of the mucormycosis, and mucormycosis in diabetes mellitus is very common. That can cause rhinocerebral involvement. Okay. Whereas aspergillus infection, that will have lung involvement, and these patients will have fever, cough, chest pain, and there will also be difficulty in breathing as well in case of aspergillosis, but you don't have rhinocerebral involvement. Next, important feature of the Henon-Chollin's purpura. Raised IgA, membranous glomerulonephritis, absent radial pulse, aneurysm of the branching point. So HSP, it's a small vessel vasculitis. The another name for this is, it is also called IgA vasculitis. Why? Because when you do a cutaneous biopsy, you have the presence of IgA surrounding the vessels. So raised IgA is very much feature of the Henon-Chollin's purpura, which is seen in the pediatric population very commonly. Drug of choice for the management of xerostomia: cevimeline, 3,4-aminopyridine, neostigmine, and then physostigmine. So in case of xerostomia, that is dry mouth, the drug that we give is the cevimeline, right? This cevimeline hydrochloride, it's a cholinergic agent with muscarinic agonistic activity. It's a cholinergic agent with muscarinic agonist activity, and this prominently affects M1 and as well as M3 receptors. So the answer is cevimeline hydrochloride. So that is about the drug for the management of xerostomia. So these are the questions of NEET GT 12. Thank you very much.